All right, all right. Let's see. This is needs some charging too. Let's see. Can you hear me? Can you hear me? Yes? Perfect. Now we're gonna see who is live right now. Is that you? That's big time support. Now, how can I share my screen or do something here in this live? Is that possible? Because what I like to do is to kind of, as we talk, I want to show. You see how like the video that we saw yesterday, that they could change the screen, both of them, and then it was just changing, and then we could show images. Was that after the fact?
The software that was after the fact. I don't know. I've never, but I'm sure if it's a live that does that, then they'll have a software.
Mm-hmm.
You would have the software to do that. We have 4 live viewers right now.
4 live viewers? Okay.
Yeah.
Let's see. Yeah, but I would like to show how can I do that. Let's see, if I do this, am I still alive? Alright, so for those of you guys that are here, make sure you subscribe to my YouTube channel. This is Scalp Micro Pro Clinic. We're located in Greensboro, North Carolina. Our main focus is on hair loss. We actually are one of the pioneers in the industry of scalp micropigmentation. We help our clients that comes in looking for a solution, looking for changing of their hairline, or adding density into thinning areas. We can also help those who has a scar on the scalp. It could be from an accident or it could be from a previous hair transplant surgery. So one of the things that I show on live is the procedures that comes through our clinic on a daily basis, and I ask, I actually implement. My assistant helps me a lot with giving information while I'm working, and this is actually my first time here speaking on live in front of the camera, because I always usually am the one doing the work and speaking with you guys. I want to show you guys, but one of the things that I am noticing is that there's no way for me to share the screen here. So I would like to be able to do that so you guys can see videos of the work that we do, and we can dive into questions, a Q&A. If you guys would like to know more in depth about the procedure that we do for hair loss, you guys can also follow me on Instagram, smp.victor.e, and you will see some of the results. Let's see if I could show you here. So the guy on the left, he is suffered of hair loss. In his case, is androgenic alopecia. And with scalp micropigmentation, we were able to add density and restore his hairline. How many do we have?
51.
Oh, nice.
59.
It's another video. Somebody who is completely bald on the top. We were able to restore his hairline. Like this other example. Someone that's completely bald. First session. And then this is the last session. Somebody that had a hair transplant that wasn't happy with the results in the scar camouflage, we were able to also add density and cover the scar or camouflage the scar. Make sure you guys follow my Instagram page and subscribe to my YouTube channel. You guys can actually see the work, how it's been done. So when I do have it done on myself, this is a hair tattoo. In other words, scalp micropigmentation stands for SMP stands for scalp micropigmentation, and it's a form of a tattoo. Now, for those that they say, hey, how come you don't have hair? You know, it's essentially a tattoo. Now, what I do have a hair transplant on my beard. So that's another option you can. In my case, what I ended up doing, I ended up getting it done on my beard because I don't have enough donor area to be able to provide to the top. I wasn't gonna be happy with the hairline that I was only eligible to obtain, so I seek to give to complement my beard alongside with SMP. And this is me going through the surgery. So we do offer both options, but we typically like to talk about SMP more because of the fact that a lot of the clients that comes in, they've already dealt with hair loss for so long. And unfortunately, they're not a candidate for hair transplants. And that's why we decide to complement with SMP. Also, people that went and got a hair transplant and are not happy with it can definitely help them with SMP. And then this is the final results right here. It's another example. And the hairline can be customized to your liking. For example, we do get people that come in wanting to just look like a shaved look. Make sure that nobody knows that they have this procedure done. And you will see the before and the after. Also, those who want more of a barbershop edge-up look, they can also do that. This particular case was actually a hair transplant that was done when he was young. He was 23 years old. And for somebody who's that young, It's not recommended to perform a hair transplant because from your on your 20s, the hair loss can um, someone can actually lose more hair in their 20s than their 30s and 40s. So it's recommended to wait at least when you're 27, 28 years old to obtain a hair transplant. This is another case is somebody who actually had SMP done by somebody else, and he came to us for us to fix and to give him better results. So if you already had SMP done, we can remove it. There's another service that we provide, laser removal. We can camouflage the previous work, and we can also fix some of the bad work that you've had by somebody else if you don't feel comfortable with the previous procedure of the previous provider that you have chosen. This is a case also that's a shaved look. Someone who wanted more of a semi-defined hairline with a little bit of receded, semi-round edges on the receding part. Then I have another one. This is actually for any race, any ethnicity who is looking or who is suffering of hair loss can definitely restore their hairline with SMP. There's more pictures here. I got a question says that's clean. Thank you so much. How long after what? I'm sorry. This is a permanent procedure that for you to obtain, let's say, a touch-up, depending on your lifestyle, you might need to wait, or you might be happy with the results for the next 3 to 5 years. You don't have to go through the whole process of SMP. For those that doesn't know how SMP works, we do it by sessions. It usually takes about 3 to 4 sessions long. In between sessions, we like to wait somewhere from 7 to 15 days apart to see how the procedure heals. Everybody's skin complexion and skin texture is different, so we want to make sure that that we're able to implement the pigment on the right depth, because we're trying to avoid any migrations. We try to make sure that the impressions looks like a hair follicle. So if you come through our program or our treatment, we actually offer a free follow-up session after the procedure has been done to make sure that we actually able to meet and exceed your expectations. For those that doesn't know where we are, we're located in Greensboro, North Carolina, and we offer a free consultation. So that's one thing that I like to do is to get to know you, get to know your story, understand what are your concerns, and also be able to know what expectations you have to make sure that we're able to see if SMP is the best option for you, either or hair treatments or either hair transplants. Everybody has different expectations when it comes to the type of hairstyle you're looking for. In my case, I'm really happy with cutting my hair short, having SMP, and keeping my beard long. So that's my style. That's my the best option that I could get for me, and I'm really happy with it. I've had it done for about 10 years now, and I've done a couple of sessions over the years, and I couldn't be any more happy about my SMP results. I also did 2 sessions of SMP on my beard as well. You can barely tell because the hair transplant it stands out more than the SMP itself. Was that after it healed or straight after you did it? So some of these procedures is actually right after the last session. A lot of times, the way how you see it on my pictures, they tend to lighten up about 10 to 20%. And that's the great thing about the touch up or the warranty that we provide. In case that it lighten up a little bit more than what you want to look, you can always come back for additional sessions without any extra cost. So, and that's one thing that we like to talk about on our consultations. And everybody that you see on our Google reviews, everybody that you see on our YouTube channel that has given us their testimonial, they're going to tell you how happy they are with the work and with the results that they obtain. We do have pictures of heel results as well. And it does, it looks just like a fresh SMP, but it's just minor, just a little lighter than a fresh SMP done. We do offer hair transplant consultations. We do teach, we do educate our clients. We do take some cases of hair transplants, the ones that understands the whole process of the surgery, because a hair transplant is not just getting this surgery and then wait a year for you to see the results. There are also treatments involved. There are also medications involved. And a lot of people do not understand that. So we first do, a consultation. We want to make sure that we want to check the donor area. We want to make sure that you have enough donor area to cover the hair loss area. And from there, we're able to tell you and give you an estimate of how many follicles we could do. And if it goes up to par as far as your expectations, that's when we determine if we take you as a patient or not. At the end of the day, I want to make sure that I'm providing, the proper information to every client, depending on what case they have, and also making sure that their expectations meet to what the procedure is going to give them. This is for a hair transplant. If you're looking to obtain one, my best recommendation is if you're going to be happy with your hair transplant for 5 or 10 years, that's a successful procedure. So because of the fact that hair loss is one of the things that there's not a cure for hair loss. You have to understand that for the majority of the people that are dealing with hair loss, you have to have some type of treatment involved with your hair transplant journey. Yeah, if it's for the beard, a lot of times for beard transplants, it's more of a cosmetic procedure. So you don't have to take medication. So that's a good thing. But if you already, let's say someone that had a hairline in their 20s and then all of a sudden they start losing their hair, then that's when medication, it's a requirement. But if it's somebody that never grew any beard in certain areas or never, never had any type of hair loss issue on their beard, that's more considered cosmetic. So at that point, you can just do the transplant and you don't need to be on any type of medication or any type of treatment afterwards. So that's exactly what I did on me. My beard was a little weak on my sides and up here. So I ended up obtaining it because I saw how good the results were. And I also knew that I didn't need it as much hair follicles as I would need if I were to do it on the top. So if you have any questions in regarding to beard transplants, you can subscribe, send me a message, go to our website, scalpmicroproclinic.com, and there is on the contact us section on the tab, you can send us a message and one of our specialists will talk to you and we'll set up an appointment with me personally so we can dive in more and kind of give you more inside information and pricing and things like that. Alrighty. I don't see the amount of views that we have here.
Right now we're down to 23.
Oh, 23?
Yeah. We had 50 for a good while.
Nice. Well, make sure, guys, if you guys are still watching, subscribe to my YouTube channel. I would truly appreciate it if you do. This is our first month going on live, going streaming. We decided to go this route because we wanted to show you how we do things in our office. We want to also, I want to put my face out there more so you guys can get to know me, get to know who I am, and are is able to get some information, and we'll be glad to help you in any way possible. Thank you guys for joining. I'm gonna leave this video on my YouTube channel. I'll see you guys on the next one.
Se ve clean. Okay.
Perdón, espérate, le dice que estoy live.